Hello, this is a video presentation about interprofessional teams. Before beginning, the agenda of this video is to discuss the hallmarks and characteristics of an effective interprofessional team, their purpose, what competencies each team member needs, potential causes of conflict within interprofessional teams, and how to avoid and overcome them. Lastly, I will discuss how our team functioned for this class. An effective interprofessional team delivers high-quality care that is safe and efficient and achieves the 6 aims for the improvement of healthcare. In 2001, the Institute of Medicine set forth the 6 aims. These focus on safety, effectiveness, patient-centeredness, timeliness, efficiency, and the equity of the healthcare delivered. Characteristics of an effective interprofessional team go beyond the 7 characteristics of a team, which include the presence of a shared goal for the team, shared responsibility for achieving the goal, defined team membership, possession by the team of sufficient authority to achieve its goal, interdependency of team members in accomplishing their tasks, absence of subgroups that operate without accountability to the whole team, and accountability of the team to the larger organization in which it works. There are 5 categories of an effective interprofessional team. A stable structure of the team is developed. The shared goal is understood by all team members. Shared responsibility is understood. The members' roles are well defined and understood. The leader is acknowledged by all team members. Sufficient hierarchy to enable quick decisions is in place. Adequate authority for the team to take action and achieve their goal, and stability of membership is attained. Focus of the team on the patient, respect for the interests of patients and families, generation of trust in patients and families, support for patients as partners in their plan of care. Orientation of team members to the team. Team members agree on common values, common set of processes to be used. Members identify themselves with the team and take pride of the team. There is mutual accountability for achieving the team goal and spend time on activities that build and maintain the team well. Collaborative work done by the team. Team members have respect for each other and the patient. They trust each other, have active interdependence, use scientific evidence in making decisions, have effective communication, and prevent and manage conflicts. Management of the team. Members are united and are not operating independently, outside of the team. There is timely and effective training, effective team-level operations, and support from the larger organization. The purpose of interprofessional teams is to address issues regarding patient health status. According to the World Health Organization, by implementing interprofessional collaboration, different disciplines can work together more effectively to improve patient outcomes. The Patient Protection and Affordable Care Act maintains that interprofessional collaboration is crucial in order to ensure patient-centered care. Studies have shown that working in interprofessional teams reduces medical errors, resulting in improved patient safety. It also provides less burnout because there is not only one provider treating the patient. An entire team of healthcare workers come together to coordinate the patient's well-being. Last but not least, it provides ease for patients and their families. They report that they feel more satisfied and are more willing to accept treatments. Team member competencies include good communication, respecting each other and understanding teamwork, an appropriate skill mix of personalities, individual attributes, professions, and experience of team members, having goals for outcomes and ensuring quality. They're able to reflect, accept criticism, and act on it. They're able to celebrate success. They continuously update their knowledge and education, have appropriate processes and resources, have a clear vision of their role and purpose, and they have the ability to cover each other's roles but know each other's boundaries. Barriers to effective teams include poor planning. Projects that do not have a proper plan in place will be frustrating to all involved, take more unnecessary work, and may not be successful. When specific, measurable goals are not in place, there is little guidance for the team. Sometimes leaders make plans for the team without proper communication to the other members. Poor leadership. Sometimes team members can tend to blame the leader when things do not go well. Team members can be competent and knowledgeable, but if the leader is not dedicated, inspiring, and knowledgeable, it will be a challenge. If the leader is not a true leader, then likely the team cannot be a true team. This goes along with proper training as well. It is the leader's responsibility to ensure that all team members are trained appropriately for multiple roles. Poor communication can cause communication breakdown that leads to many problems in teamwork. Every team member, especially the leader, needs to be aware of how they come across to others. Some team members may dominate, which can reduce the participation of other team members. This can be frustrating to team leaders as well as others on the team. Not everyone gets along, and this can lead to conflict. Poor performance of some team members can cause others to become disengaged. Some manage their time poorly, and some are unmotivated. This can lead to feelings of resentment. Poor rapport among team members can also lead to disengagement of teammates and cause chaos. Another concept that goes along with this is jealousy and envy among team members. Many causes of conflict can be caused by miscommunication and misunderstanding. Causes of conflict start with lack of proper communication. Poorly managed conflict. It is normal for team members to have conflict. Not everyone has the same values and opinions, and that is okay. This should actually be encouraged so that there is variety and creativity. Sometimes disagreements can slow progress, though, and when it becomes negative, this can undermine the best intended projects. Poor attitudes can be caused by the leader or the team members. One example can be the line of, "That's not my job," which can derail effective teamwork. All members of the team should be able to help one another and support each other. Lack of trust can cause the whole team to fail. Trust is something earned, and it can also be easily broken. An example of this would be making a promise that is not kept. Leaders and team members must be open to ideas by always listening actively for input of other team members. It is vital for team leaders to nurture the team members, to train them to adequately perform as part of the team. Everyone is motivated in a different way, and leaders must learn how to motivate each team member individually. It is important for team leaders to be flexible and give assignments to team members based on their strengths. Leadership should promote flexibility in their teammates as well. Every team member should be willing to step in and perform any part of the job to get the project done. I'm sure we have all dealt with a poor performer. There is usually one in every group. However, it is the leader's responsibility to help the team be successful. This means that as a leader, you must try everything to help all team members be successful. But it is also the leader's responsibility to let go of a team member if they are dragging down the success of the group. Some weaknesses of our team included time constraints and being overworked, as some of the team are still completing clinical residency hours in addition to the regular online classes. Due to the fact that team members have so many tasks at hand, not enough emphasis can be put towards the set team goals at all times. Being overworked will lead to burnout and less motivation to complete other tasks. Distance was also somewhat of a burden for our group, as it can be difficult to communicate effectively over the internet. One of our strengths, however, was that we used both GroupMe chat and Brandman email to communicate almost daily while completing our group assignments. This equated to strong communication lines and accountability. Good communication is key in any interprofessional relationship. Assigning specific tasks to each member prevented the team from doing the same thing twice. Communication also kept team members involved and motivated to complete the assigned tasks. Accountability to each other was also a motivator, and tasks were completed by the set due dates.